What we've done is we got like a working group together. We got all our international nurses in. We sat down with, I think it was about 80 of them to begin with, to make sure we embraced every single different quirk or thing that we were doing, and what we'd got wrong, what we could improve on. This is all part of, we've also introduced as a trust retention partners to talk to everybody who comes into the trust. We meet with them on 1 month, 3 months, 6 months, to get that learning of what we could do better. So they said that sometimes when they sit in the classroom or when they're in the big groups, that the quieter members of the team feel embarrassed to put their hands up, etc. So we also ensure that they have like an hour every other week, 1-to-1, and then before the exam they have that 2-hour dedicated session. We've seen our pass rates go up from that, and we feel that once they've got their OSCE, they feel much more confident to speak up going forward into further training and development we give them across the trust. We've seen a much happier workforce. We've seen what we do really carefully is when people join us and our international nurses, for the first 2 years, we really monitor whether they're calling in sick, what their mood is, 1-to-1 an hour with their coach and their previous OSCE for the first year. And then obviously they have at least 1 hour dedicated in work time with their buddy, just to make sure that they feel fully integrated in the community. And to ask those odd questions. The NHS has its own language. A lot of the time they found that they didn't quite understand things. So we wanted to make sure we give them like a little, what we call your quizzical question book, that they can just jot it down and then remember to ask those questions when they're in that session. They also have a once a month meeting with our retention partners, one-on-one, to see what we can do to support them more, see whether or not they're happy in their accommodation, whether or not everybody gets on, and sometimes we place them and they don't feel comfortable in the little groups they've been put in, so we make sure we move them, because it's just so important. They've given up everything for us. We've got to really look after these people while they're in our care. I think the learnings for the board is we do take what we call an international story to board each month that we talk, and once every 6 months we get 2 or 3 of our new recruits to come to the board and tell us their story, tell us their journey, tell us why they decided to come to us, the good, the bad and the ugly, because I think there is an awful lot to learn. I think when you take the time to do that, we do a patient story, an international story and staff story every to our board, because I think being a board member, you see things very differently, and through different layers of a massive organisation from ESNEFT, we've got to make sure that we really do hear and feel how our staff hear and feel, and that has really improved our retention rate across the trust. In the 12 months we've been doing this, it's only been in for 12 months, our retention rate was at 13.9%, and today it's at 8.7%. That's for our whole workforce, not just our international, but it's so important. These are our people, we have to look after them. I think if you, as a board and as an organisation, I think as a board member, you have a responsibility to look after every single person in the workforce. I think it's so easy to get caught up in the money, the data that we have to provide to prove that we're a good organisation. And sometimes you can forget the voice of the people. And as a trust, we really do embrace our people, and it's so important. Just take that time to listen. I think one-on-one, listening to an international recruit, having the strength and the guts to come and sit in front of a daunting board and a sea of what you call very senior people, they've taken that step, take the time to listen. We have learned so much, and it's given us such a breadth of understanding of what it's really like. I think is you leave your family, you leave everything with a suitcase, come into a different country and see just how hard it is. It's so important, and we have the privilege that they've chosen to come to us. I mean, we're just lucky, and we embrace every single one of them. There's a lot to learn, and we've still got a lot to learn. My other comments would be is through COVID, we've done a lot of what we'd call Zoom recruiting. I think it's really important as trust we go back into the communities, we take the time they've qualified the people. I think it is time the trust went back into those communities to thank them and give something back, because these people give up their lives, their families for us. we should at least go back into those communities and give and show to their community how much they're appreciated, to let their families be proud of what these people have come to give us.